My name is James Wooten. I'm the Preparedness Coordinator and Safety Officer with the Dare County Department of Health and Human Services. What we're doing today is doing a full-scale exercise of our department's mass dispensing abilities. So the scenario is that we're in the midst of a major public health crisis, and we have depleted our local assets of major antibiotics. What we've done though is realize that we are running low. We've requested assets through the state to the federal level with the Centers for Disease Control and Prevention. The CDC operates a program known as the Strategic National Stockpile, which is pre-positioned caches of medication, flu vaccines, materials such as gloves, and these can be deployed in a major health crisis to any local government that asks for them through the proper chain of command. What we're exercising today is our ability to dispense those medications to the public in as close to a real-life setting as we can set up. What we've done is divided our Department of Health and Human Service staff between different areas, one being the command center at the Emergency Operations Center, and then another being here at one of our pods, also known as a point of dispensing. Within the pod, we have folks helping out with educating the patients who are coming through, triaging them to make sure that sick people aren't arriving and coming into the pods. We're also registering them so that we have names and phone numbers in case we need to call them later to follow up. And then most importantly, we have our dispensers who are dispensing the medication per certain algorithms and prescriptions. And then we are providing some exit education so they know what resources are there for them after they leave the site. And then we're sending them on their way to go home and take care of themselves.
Public information is extremely important in the event like this. We want to make sure that our residents feel like they've been communicated with, they know where to go, they know when to be there, they know what to expect while they're there. Communicating like that assures that they're able to make the best health choices for themselves and their family. Today has been a real eye-opener for us and our team. We've been able to see what works and what doesn't. We've been able to mimic what this situation would be like in the event that something like this did occur. And we were able to kind of work out some of our problems that we saw as we were working through the process.
Health has many, many important responsibilities, but probably none more important than responding to a health emergency that might break out in the community. We think about hurricanes, but it could be terrorism, it could be pandemic flu, some other kind of disease outbreak. So it's something we take very seriously. We've got an awful lot of community partners that are helping us. It's very important. We've got the hospital, the fire department, the Red Cross, law enforcement, just a host of individuals who are here. You know, it's the kind of responsibility, you hope we never have to implement. But it's very important. It's something that the community and us take very seriously. So we're testing it today, and hopefully we're going to be prepared if it should become necessary.
So for the first time that I got to go through the line, I went as myself with no pre-existing health conditions, special needs, anything like that. The second time we went through, I was able to go as someone else. Information was written on a card. So I did have allergies that needed to be presented, and I was also picking medication up for my 3-year-old daughter. In the beginning, we were waiting outside for quite a while, and I think that's what it would be like in a real scenario as far as people being scared, panicked. They're just waiting, they're not knowing what's going to expect once you get inside. It moves very, very smoothly and very quickly.
What we're doing is distributing different patient cards that has the very vague who you are, how old you are, whether or not you have any allergies to drugs, whether or not you're feeling distressed and very anxious, whether you're a young child who might be here without a parent, or you might be a person with special needs. And the reason that we have these different cards is to test our ability to react to those different scenarios where a person might have that allergy medication and we might not be able to give them drug A, but they can take drug B safely.
It is incumbent upon us to do this occasionally just to make sure that all of us understand our role in preparing and responding to a situation such as we're dealing with today. So there is a large number of people involved anytime that we try to put an exercise or a real event like this together.
What I've seen with this exercise is that our staff has met and exceeded expectations, not just in putting people through our dispensing site at the rate that we have in our plans, but really going above and beyond, stepping into roles that they don't normally fill. And they've also been empowered with the ability to solve problems on their own with their supervisors through the proper chain of command that was instructed to them at the beginning of the exercise. These exercises are a great opportunity to re-strengthen those bonds that we have with the different partnering agencies and also within our own staff with the Department of Health and Human Services. I think the folks here in Dare County particularly the employees, do an excellent job of rising to the challenge and performing tasks as needed. I think this exercise has been a tremendous success.